Hey guys, it's Dr. Kyle again with the Winning Clinic Formula. And today we're going to cover how to stop spending 80% of your time on the 20% that doesn't matter and how to start spending 20% on the 80% that's going to move you forward, even if you feel stuck and unsupported currently. Now, frustrations that I hear a lot from our doctors when we first start working with them are that they're working way too hard for the results that they're getting. They feel like they're putting a lot of the energy in, and I call this martyr syndrome, where they're not allowing their staff to support them. And we'll get into that later. Another frustration is that there's not enough time in the day. And so these doctors, they feel pulled in a million different directions, right? They have to wear the CEO hat. They have to wear the COO hat. They have to be the treating physician. They have to be the marketing person. So they're ultimately in this state where they feel like they're about to snap and that they may be wasting their valuable time in a fruitless pursuit. So what they're looking for is increased revenue without sacrificing their time, right? They don't want to be spending weekends at trade shows and fairs actually trying to drum up business when they just spent a busy week working in the clinic as well. Another thing they want is to spend less time putting out fires. If the clinic can run in a systematized, organized fashion and people are actually mind reading what's going to be happening next because they understand the cadence of the office, uh, good things can happen for the doctor and a lot of time can be spent that way. What you want is to feel supported by your staff and the process, right? You want to spend less of your time putting out fires, but also wearing so many different hats that don't move the clinic forward. And really, you want increased revenue without sacrificing your time and your energy. Your family deserves your time as well. And so it's important that we can give back to that and be there for our family at the end of the day and have a cup that's full. And the way we do that is honestly feeling supported. And so I'm going to go over 5 keys of that that I've found that really help move the needle in this so that you can start spending 20% on the 80% that matters, right? We know that your patient interaction is the most valuable to the clinic right now, right? So how can we make that more efficient? Well, one key we came up with is called using routing slips, right? Having a very organized, systematized routing slip that the whole office understands. And so it isn't having to ask questions consistently over and over and over. It's picking up a routing slip, knowing where that patient's going to be going in the process, and then going through the process to make that happen. So everyone from the front desk to the staff helping with patient interaction to billing, like everyone understands exactly what's going on. Number two, I fought it tooth and nail, but scribes actually save a ton of time. The fact that you're not sitting there going back normally at the end of the day and trying to make up for all the notes you had, especially in a busy clinic where you're 50, 60, 70, maybe 100 patient visits a day. How in the world are you going to remember everything that went on? So having a scribe with you that's probably already part of your team is a really valuable tool to start freeing up your time. We've seen a lot of our doctors do really good with this strategy. Another thing, this is a big one for me. If you're anything like me, you go to seminars, you go to right now virtual seminars, and you learn a ton of things that you want to implement in your office that you just know are going to move the needle. Your staff gets what I call whiplash, right? And so you're trying to explain everything that you're excited about. They're looking at you kind of glazed eye. And really what you've done is given them whiplash and they're just waiting for you to kind of get over it and move on to the next thing. So what I like to do, you can call this a parking lot, you can call this putting things on ice, but really you have a place where all of the good ideas go, and at very strategic yearly planning, quarterly planning, even monthly planning, some of these things can start coming out and be talked about. So it isn't just like overnight you've decided revenue's down and that everyone needs to start doing X, Y, or Z. The biggest thing that'll move your needle is to actually understand where your time is going right now, right? Too many of us think we're busting our butt and that all these good things are happening in our clinic, but we're the ones making it happen. And they're like, again, there's this martyr syndrome that nothing can happen without you, but really you might be the stopgap. So, an important thing to look at is to tell your time where to go. We have our doctors do a time study where they actually look at, are they working on the business? Are they working in the business? Are they spending enough personal time on self care? Are they doing enough things with their family so that they're a very well rounded doctor who enjoys their life? But more importantly, understands that they don't have to put the 80% into the 20%. They can put the 20% into the 80 and really move their clinic forward in a great fashion. And another thing that I found that really, really helps is to get very streamlined about what I call doctor calls, right? When someone's been into your office, giving that personal touch afterwards to see how they did with treatment, to follow up with them from you, but it doesn't have to take a lot of time. We've created scripting around these things where it's very easy to just do a check-in call and see how your patients are doing. Now, if you don't have an efficient clinic right now and you want to get everyone pulling in the same direction, or maybe you feel like you're in complete overwhelm and are doing everything by yourself, martyrs, and you want a system that allows you to build confidence in the team and create a process and a cadence and a rhythm, if you'd like help with that and your service offerings and how to really streamline your process, then click below to watch my Profit Maximizer crash course and learn the 9 components of a 7-figure clinic and how to go from feeling vulnerable in practice to feeling more confident and secure and supported. I'll go over the 3 keys to maximize efficiency, maximize profit, and how to scale your clinic. And I think you're going to be really excited to go over that. As always, I'm Dr. Kyle, and I look forward to talking to you in the future.